charge, or having a foreclosure, or you're having any kind of court involvement around domestic violence, these sort of smaller crimes. And often those things get all lumped in together. Especially in settings of suicide, the question about legal entanglements, legal troubles, is often approached as a single question. Did they have legal troubles? Yes or no? And what we have now is an opportunity with the electronic coding of court data to really look at some of these questions on a population scale. Or we may have that opportunity. And in Summit County, they already have a county-wide court database system that pulls data from all the different courts into one interface that allows us to look at that population. And so what we hope to look at is trying to get a better measure of how common is court involvement among those suiciders that have died prematurely. Estimates vary widely depending on how you define court involvement. But the other problem with that is that it's always relying on a proxy reporter to say whether or not they had court involvement. So it could be a spouse or someone else to report that. The nice thing about archived court data is that there's no bias. It's true for everyone. All right, so it's accurate for everyone as far as the court involvement. Another feature of the electronic court data that's made this type of research possible is that we can pull in the full richness of the data as far as number of court appearances, when it occurred, court complications, so having a warrant out for your arrest, or having a prolonged case for a particular offense. Those kind of court things. We can look at all these things using archived court data. So it also, again, not just looking at criminal cases, traffic offenses, domestic cases, civil claims, and also looking at having multiple of those things happening at once. So it allows you to look at really important life stressors, divorce, foreclosure, other things happening in a person's life. And it kind of creates a constellation or a better picture of what people are experiencing. And we wanted to decide to see, is this a useful way to measure court involvement? Because increasingly court systems are integrating their systems, and there are now some states which all report to a central court data system. And what would this mean as far as surveillance of suicides, looking across much larger populations, and what are the opportunities to look at the timing of these types of events in relation to death? So that's really the goal. And also as a system, courts where increasingly those with mental health problems are showing up first. And so, especially among younger males, it may be the only system in which they have any contact prior to death. They're not going to have contact with primary care physicians, they're not going to have contact with the mental health system. So if suicide victims are showing up in the courts, it may be the last formal system in which they could receive some kind of prevention or some sort of referral or any kind of recognition that this is a person that's having some sort of crisis. Because a lot of the folks who are showing up for petty crimes, minor offenses, usually it's an indication of other disturbances in their life. It may not be a pattern of constant criminality or constant offending. It may be a marker for other factors happening in their lives, including relationship trouble, financial trouble, things like that. So the reason we're doing this in Summit County is they happen to have this multi-court database, allowing us to look at all the different types of court types, different cases. So this is really a unique opportunity to look at this at a population level, and to also look at groups that are underrepresented in studies of suicide, including women. Often, as a percentage, it's very small. And we're able to look at risk factors among women as our sample to say something about these groups. So the overall goals, well, two sets of goals. One is measurement related. How can we better get an estimate of how often folks are showing up in courts prior to suicide? And this is our best way to do it. Court data, you can change your definition. You can say, well, ever, were they in the last 10 years? Our definition was within the past year, thinking of it in terms of a precipitating factor. A better funded study or more ambitious study might look in a 5-year involvement, trajectories and patterns of involvement, and that would be a worthwhile goal. And also to look at the timing more accurately. So if you say somebody had legal troubles, well, when did it occur? And was that legal trouble a precipitating factor as opposed to some predisposing factor. And then to really look at not just snow, but what are those court-related actions and stressors that might trigger someone to suicide. So is it facing another court appearance? Is it facing or having a warrant out for your arrest? And if you look at the timing of it, when the event occurs within a week of death, you can start to look at some of these connections. It's a lot better than if somebody said yes, they had legal trouble. And it also captures types of legal trouble that loved ones or whoever's reporting may not think of necessarily as legal trouble per se. The other set of goals are more policy related to say, well, courts are increasingly recognizing the fact that they're serving a population with extensive mental health problems more and more so as the mental health system continues to deteriorate, some would say, or at least is more fractured. And so the courts, mental health courts have been created in certain states, somewhat on a pilot basis, and some are pretty state, I think, where they're doing a better job of recognizing potentially suicidal or people with mental health problems as a separate type of case among the drug courts. So what would this research lead to that as far as understanding the prevalence of mental health disorders, and suicidality, prevention of suicide? And also this notion of therapeutic jurisprudence, which says that courts have both the ability to heal and to do harm. And so courts can be a stressor, it can be a precipitating factor. If it's a mishandled case, it's a very formal system, and maybe somebody who's really needing a more compassionate form of care. But it has an opportunity to both. And this study is trying to document just how often courts are showing up, and these opportunities for intervention, but also how much are these courts producing the stress that leads to suicide. And then looking, if we're getting a better, more accurate measure of court involvement, how does that compare to healthcare system contacts, especially for certain groups? Because if you look at a young male who may be physically healthy, he's probably not going in to see the primary care physician, and he may not be going for mental health, but if he's showing up in court, that may be the only opportunity to intervene. And the other motivation here is that suicide is a very underfunded area of research, and there are some new initiatives to create better surveillance systems for suicide. One of those is the National Violent Death Reporting System, which I think there's 17 states participating in it now, and it's using these administrative records to create a better system for tracking suicides and elucidating risk factors. And we're hoping that this study will generate enough interest in using court docket data, which is readily available in certain areas, as part of this surveillance system, so we can really look at these things at a population level, a national level. And another thing for this paper was to see how efficiently can one do this, what are the problems with the data, what can we learn from it, what would the cost be of integrating it. For this sample, we had 5 years of data, which captured 315 suicides in Summit County. We also looked at accidental poisoning deaths as probable suicide in some cases. It's very hard to issue a classification of suicide. And then another sample of other premature deaths. We don't have a traditional control group here because we're talking about all deceased individuals, and anyone who dies prematurely has a different set of different risk profile than a living control. But for the purpose of this, we were looking at suicides and trying to find one of those patterns that are specific to suicide victims as opposed to other types of deaths. We expect that if you would have a true control group, some of the things I was talking about, the risk associated with court involvement would be higher than what's been found. We restricted the sample to those over 19, just we don't have criminal justice data. We wanted at least that 1 year of court involvement. And it was based on matching the official death certificates to the court docket data based on multiple